Our last session of the afternoon and continuing on the theme of bringing community voices into the room. In this last section, we're bringing the voices of young investigators and young influencers into the room. This is also a first for our forum in calling out to young people and asking them to come here to the meeting and to present their work. And we put out a call for posters, and we had just a few requirements that you be a young investigator. We actually didn't define that exactly, and so you'll see that there's a bit of a span there. We asked that they be involved in research or a program involving some integration of health, nutrition, education, and social protection. We asked that they submit a poster and an abstract, and it was actually optional to be here to present. You could either submit a video or you could come in person to make the presentation, and so we have some of both. We're going to begin with a video, and our first presenter is Charles Masalani Mawali, talking about caring for children with intellectual disabilities in Malawi, parental psychological experiences and needs.
The majority of these children, including their parents, suffer a lot as a result of the disability. The parents also experience mental health problems, including depression and other mental health problems. There is little research from Africa addressing these issues, especially among parents of intellectually disabled children. WHO encourages research on the impact that these children have on their family, and also that we training interventions and also identify supports that are required by these families. My study investigated the parenting experiences, the mechanisms of coping with the challenges, and their psychosocial needs while caring for these children in Malawi. This was a part of a larger mixed method study aiming at developing a contextualized psychosocial intervention for parents with intellectual disabilities. 16 FGDs and 4 ideas were conducted with parents in Mzuzu and Lilongwe cities, and ethical clearance was obtained. Data was analyzed using in vivo. We found that parents experience stigma and discrimination. They fear for their child's future, including violence by and to the child, have self-blame and guilt. They get coerced by neighbors to kill the disabled children. Their needs include respite relief, disability services, education, disability management, and in some cases, financial support. For their emotional stability, they cope by sharing with others, and sometimes they tend to court, while others also use poor coping mechanisms like taking alcohol. In conclusion, apart from the neighbors' cohesion for the families to eliminate the child's life, most of the findings in this study are similar to those done in other countries. And we hope that further studies need to be done to design culturally appropriate and specific psychosocial intervention that can promote the parents' psychological resilience. Thank you for your attention.
Okay, you'll see these are going to be fairly lightning presentations. We've given people 2 minutes to make their presentation. I want to add that immediately after this, we're going to convene to the atrium where we have 10 presenters who are here in person who will be there, and you can ask them further questions about their work. So our second one will continue with our video presentations. Patricia Wakulo is going to talk about linking socioeconomic status and the home environment to language and motor outcomes in children.
Good evening, everybody. My name is Patricia Wakulo, and on behalf of my co-authors, I'm going to present our poster entitled Linking SES and the Home Environment to Language and Motor Outcomes in Children. The work presented on this poster is based on 2 studies conducted in rural areas along the coast of Kenya. The first study was conducted among a school-age population and the other among infants. The study tested the hypothesis that factors closer to the child, what Bronfenbrenner refers to as proximal processes, that is, stimulation within the home environment, have a stronger influence on child outcomes than those further away, such as household wealth, referred to as distal contexts. We used structural equation modeling to test the effects of these factors on children's language abilities and motor skills. Both the school-age and infant models provided an excellent fit to the data. As can be seen in figures 1 and 2, age was associated with the two outcomes in both models. Greater household wealth was related to more enriched home environments. As expected, household wealth was not directly related to child outcomes in both models. Boys in the school-aged population had higher language scores than girls. Among the infants, girls performed better than boys. Our hypothesis was only partially supported by the models. Our findings provide evidence of the mediating role of the home environment in the relationship between household wealth and child outcomes. Thank you.
Okay, moving right along, our next presentation is Mubarak Ara. If you could come forward. Is Mubarak here? Okay, so we'll move on. So the next presentation is Bete Demike and Amelia Darmstadt, talking about enriching educational experiences for Ethiopian children at Project Mercy.
My part here is very small and very short. Amelia is going to talk about the program, but the reason I wanted to just introduce her is I see a very important affinity between not so much even the program, but what she herself is doing and what she's about to present. Last year, when she was 16 years old, she came to Project Mercy for a visit. The passion caught her, and today, at age 17, she is here presenting to you her concept. And that is what I think is most important about this, the youth thinking about how to develop the youth. And I hope you like her presentation. Amelia.
Like Bete briefly mentioned, in April of 2014, I had the opportunity to visit Project Mercy, where I volunteered in the kindergarten English classes and tutored some fifth graders in reading. And during my time there, I learned about and observed some of the following challenges. So, beginning at the end of 8th grade, students are required to take national exams, which are given in English, and students must pass these tests or else they are permanently removed from formal education. And unfortunately, unfortunately the teachers themselves are not proficient in English, so this causes the students to be inadequately prepared for their exams. Some other preventable factors that limit students' learning include poor health, undernutrition, and a lack of basic needs, for example, shoes, given that many students must walk long distances to school. In order to optimize students' learning at Project Mercy, we have created a program that addresses some of these issues. So we have, to address education, we have partnered with Taylor University to create a teacher enrichment curriculum that will expand the teacher's English knowledge and enhance their teaching skills. This will begin with the kindergarten teachers and progress to include teachers at all levels. Project Mercy will also ensure equal representation of boys and girls in the classroom, as well as provide literacy training for women through outreach to neighboring communities. To address healthcare, volunteer professionals will conduct physical and eye examinations, and funds will provide for eyeglasses as needed. Breakfast and lunch will be served to the students at school so that they are properly nourished and able to learn and perform better in their classes. In addition, each student will receive a pair of donated Tom's shoes. And we are raising these funds through crowdfunding and are launching this program this coming September. This project will lead to improved educational and employment opportunities for the hundreds of children at Project Mercy, and this will give them, their families, and their surrounding communities a brighter future. Thank you.
A little bit proud. Okay, our next speaker, Raymond Abuolo. Is Raymond here? Raymond is going to be talking about A Mile for the Brain, social entrepreneurship in the last mile access of complementary foods for weaning children.
Good evening. As you said, my name is Raymond Abuolo from Kenya, here representing Global Integrated Innovations. I want to talk to us briefly about our project titled A Mile for the Brain. It has a long title, A Mile for the Brain, Social Entrepreneurship in Last Mile Access of Complementary Foods for Weaning Children. So this is a two-year study. We began in January this year. The project is being undertaken in Meru region, Meru County, that is in Kenya. The project is being spearheaded by three of us. That is Florence Morania, who is the principal investigator. We have Pamela Moduri, who is one of our managers, and myself. So our project was informed by two problems. One is the limited access of complementary foods for weaning children, which comes from two issues. One is the uncoordinated efforts and lack of economies of scale in the last mile of access. The second one is poverty amongst rural women. And it's these two problems which basically informed the project objectives, which are two. One is to reduce malnutrition among children aged 6 to 24 months. And then the other one is to economically empower women. So this project has been supported by Grand Challenges Canada. And the ultimate goal of this project is to provide proof of concept in three areas. One is to see whether, if we leverage the networks of rural women, we can increase access to complementary foods. And the second one is the effectiveness of repackaged complementary foods. So we realized that the purchasing power of people in rural communities is quite low. And this limits the access to complementary foods, which are mostly expensive. So if we increase this access by, encouraging economies of scale, buying in large scale and repackaging into smaller quantities and reselling, then we hope to overcome that problem. And the third one is the economic empowerment of women through a unique social entrepreneurship model. Thank you.
Next speaker is Ronald Santua, speaking on re-engineering literacy practices for children and beyond, a case of the community reading tents in the slums of Kampala.
Thank you so much. Good evening to everyone. Yes, my name is Ronald Santua from Uganda, and I'm here to share my experience in promoting community literacy in the communities. Today we are here discussing investing in young children globally, supporting family communities to invest in young children. And basically, if we talk about that, we need to share what kind of interventions are in there to support children, to support the communities to help children develop. I do promote community reading tents in my country, and a community reading tent is an activity where you have quite a number of activities. It includes storytelling, free reading, painting, read aloud, shared reading, and you gather children within a community and they are supported by their caretakers, parents, local leaders to do reading. And this project have been doing it for the last 5 years in Kampala, in the urban poor communities. And I've realized that it has got quite a number of good benefits to the children and the communities, just because it gives them an opportunity to advocate for reading for children, and also it brings out together different stakeholders who are like politicians, policy makers, to understand the need and what is required to help the children develop holistically. And also, when you happen to have a community reading tent, it's an opportunity to mobilize children within the communities. Sometimes it's hard, but during the process of preparing ourselves for the event, we walk into the community, have transact works, and identify the different community leaders who in turn hope to mobilize families and children to come and take part in this activity. So it gives that kind of participatory approach to supporting children to come and take part in this activity. And also, it's an entry point to provide other services to these children. For instance, it gives you an opportunity to integrate programs like social and financial enterprises for children. It's an opportunity where you can mobilize children. In terms of conclusion, because my time is out, we are having 2 minutes. The community reading tent is something which it gives you an opportunity to promote the pillars of child development, which looks at home visiting, which looks at play, and also I would say that if you are to help a child develop holistically, a reading tent has got the issues of active engagement. It brings issues of internal connection and stimulation, issues of social connection, and then meaningful learning. And I will encourage everybody to replicate it elsewhere, because it's an evidence-based intervention on my side. Thank you so much.
Okay, our next speaker is Rosa Hextra. Rosa, would you come forward? She'll be speaking on increasing awareness of autism and other developmental disorders among rural Ethiopian community health workers, impact of a brief training.
Thank you. I'm Rosa Hoekstra, working at the Open University in the UK, and together with colleagues at Addis Ababa University here in Ethiopia, we did a study in health extension workers, generously funded by Autism Speaks. In Ethiopia, very basic health services are provided by health extension workers in the rural areas in Ethiopia, and currently more than 39,000 of such health extension workers work throughout the country. Up until 2012, these health extension workers received basic health training that didn't include any mental health training. But from 2012 onwards, the Ethiopian government started upgrading the skills of health extension workers with the HEAT curriculum, and this curriculum includes a brief training on mental health of 2 weeks. And in this poster, we examined the impact of this training on raising awareness of developmental disorders amongst health extension workers. We surveyed 300 health extension workers who all work in the SNMPR region of Ethiopia. And these 300 workers were divided into 3 groups. One group was the basically educated health extension workers who are currently working in the region. There was one group of 100 health extension workers who'd done the HEAT curriculum, including the 2 weeks of mental health training. And then there was one group who'd done an enhanced version of the HEAT curriculum, the HEAT Plus curriculum, which included a larger focus on childhood mental health and especially on developmental disorders. We surveyed all these health extension workers with a survey and gave them 2 case vignettes, one describing a child with autism and one describing a child with intellectual disability. And after describing these vignettes, we asked the health extension workers, what do you think the condition described in this vignette is? And do you know any children in your community who might have this condition? And what we found is that the HEAT group and the HEAT Plus group was more likely to recognize these conditions described as developmental disorders and to know more children in their community who might have these conditions. So this suggests that this training helps in identifying kids with developmental disorders in the community. We also asked them if they had disseminated their knowledge through the community using organizing a mental health awareness raising meeting. And we found that the trained group, 97% of the trained health extension workers had organized at least one mental health awareness raising meeting, and only 11% of the control group had done so. So this suggests that this training equips health extension workers with the skills and the knowledge and the confidence to organize such meetings. Thank you very much.
Our next speakers, Silas Okengo and Deden Menyara, talking about development of a mobile application to support parent education, a case of Nairobi, Kenya.
Good evening. My name is Silas Okengo, and I apologize for my friend. He couldn't be here today. Him and I are IT students. And in the last semester of our first year, we're required to identify a real-life problem and build an IT solution to it. The problem we identified was that although parents want the best for their children, they often needed critical information that was often not easily available. There are few parent education programs in Kenya, and due to many commitments, most parents are not able to participate in existing programs. To give us an idea of the extent of the problem, we sent out questionnaires to assess basic parental knowledge on developmental milestones. The results show that only 44.6% of the parents knew the key milestone development among children. Over 70% indicated the need for easily accessible information regarding how to support their children's development. Considering the rapid growth of mobile phone usage in Kenya from 3% in 1999 to 93% currently, we thought a mobile application with parenting information would be one solution to the problem. The parenting app provides information on developmental milestones and what parents can do to support their children at a given age. The app is still a work in progress, but we are looking forward to working with early childhood experts in making it interactive, where parents can ask questions and receive answers. We're also working on sharing the same information using an SMS system for those parents who cannot access internet connection. Thank you, and please look for our poster for more detailed information.
Next speaker, Attanasio Gasaye. Development in rural, low literacy setting of Ethiopia.
Good evening. Thank you for the opportunity. My name is Attanasio Gasaye, and I'm working for Christian Children's Fund of Canada. And I'm going to present a 2 years research project, which is being implemented in 7 intervention and 7 control sub-districts or kabalis of the rural areas of Arsi-Nagarli district in the Oromia region, Ethiopia. So the project is applying to complementary knowledge delivery approach, which are fit to the rural settings or low-level literacy parents, which help parents to help them nurture and care for their children. The first approach is called Learning Through Play program, which is focusing on providing learning through play calendars to parents, which help them stimulate their children development and growth in the area of physical, cognitive, motor, and other areas of development. And the second approach is called Audiovisual Early Brain Development Program, which focuses on disseminating locally produced videos that focusing on early brain development in maternal and child health. And this video message will be distributed to or disseminated to parents to help them understand better about the subject and to better nurture and care for the children. And by using this approach, we expect that early lives and brains of children at young lives, especially our targets are focusing on children 0 to 3 years of age. And by using such methods, we are expecting that will improve the early lives and brains of children. And at the highlight of the baseline survey, we have found out that only 12% of parents in the intervention group and 8% of parents in the control groups were able to answer 50% of the questions around brain development. Thank you so much.
Our next speaker is Yukiko Amnan, talking about establishment of the network for the African Network for Early Childhood.
Good evening. I'm Yukiko Amnon, representing the African Network for Early Childhood from Liberia. As you know, civil society organizations play an important role in providing various services among poor, disadvantaged, and difficult to reach population. They not only target children, but other critical stakeholders, including parents, communities, and different levels of government agencies. As frontline workers, they are strategically positioned in connecting communities and national governments in a unique way. Civil societies play key roles in creating the right demands for policy programs, working across sector and other critically important in holding the government accountable to the people at all levels. Civil society organizations, however, often implement proper programs in an isolated manner. There are few and unaccommodated opportunities for being civil society organizations to exchange knowledge and strengthen their voices for greater impact. What is African ECD Network vision? Our vision is that all children in Africa grow up in a safe, healthy, and happy environment and will be able to strive and achieve their full potential. Our mission, the African Early Childhood Network, seeks to promote excellence and coordination in early childhood development, protecting children's rights, and influencing policies, practices, by being the leading voice on all early childhood development issues affecting children in Africa. We have 4 key outcomes with activities, but the presentation will, as you read through it, you will see more, but I will only read the 4 key outcomes that we hope to carry out between now and 2020. Our first outcome in Africa is that Africa will have established stronger and more dynamic national networks. Also, ECD policies implementations enhanced. We also hope to continue the sharing of knowledge, good practice, and enhance innovations in ECD. Our fourth and final outcome for 2020 is a continental ECD agenda that addresses critical gaps in development, disseminated and adapted across Africa. Thank you. The presentation, the poster will give you more detail on what we hope to accomplish from now to 2020. Thank you.
Again, our final speaker is Nina Sporer. Nina will describe the ECD funding map that they've created.
Good evening, everyone. My name is Nina Sporer, and I am Manager of Strategic Philanthropy at Foundation Center. We are an NGO based in New York City. We built an interactive map that shows foundation funding and bilateral and multilateral aid for early childhood development in East Africa. This map is for foundations, NGOs, policymakers, and other stakeholders working in ECD. With it, you can see your work in a broader context, you can understand what peers are doing, and also find partners for collaboration. So here's how it works. Here we're looking at nutrition funding for nutrition in 2012 and 2013. Nutrition is one of 8 ECD-related categories on the map. The 4 summary boxes at the top represent foundation funding and bilateral multilateral aid in aggregate amounts. The green bubbles represent the foundation funding, and the yellow represents the bilateral and multilateral aid. So you can see right away that there's a lot more bilateral and multilateral aid coming in for this. The different shades of blue represent 1 out of 3 country-level indicators that include GDP, mortality rate, and undernourishment. Next slide, please. You can drill down on an individual country to find out more information. Here we're looking at how much funding has gone to Ethiopia for nutrition. Next slide, please. And you can pull up a list of funders. So here we're looking at funders who have been funding ECD in Ethiopia since 2008. There's also information and lists of recipient organizations and donor countries providing bilateral and multilateral aid. Next slide, please. And here is a grant profile where you can see the purpose of each individual grant. So please visit the map at ecdfunding.org. I've left postcards at all of the tables in front of you, and please come find me afterwards at the reception to ask me any questions you might have. Thank you.
So I just want to thank each of our presenters from coming really from all over the world, but we really had fantastic regional representation, which is exactly what we were aiming for. Thank you very much for your ideas, for all the effort in coming here. I'm sure that each of the presenters would appreciate your interest and your questions at the reception. For more details, you can see each of the posters that are posted in the Dropbox, the public Dropbox, at the ICYG site. So it's been a great day. It's been a long day. We're adjourned now down to the atrium for reception, and we'll see you back here at 8 o'clock tomorrow for networking breakfast. Thank you.